This is a community analysis of Safety Harbor, Florida, presented by Kelsey Fix, a student of St. Petersburg College ADN to BSN program. This presentation will address 7 main objectives. The first one being a historical overview, a structural analysis, a population analysis, an analysis of health-related resources and availability, an environmental analysis, government and public policy analysis, and lastly, community needs. The Tocobaga tribe are the first documented inhabitants of what is now known as Safety Harbor, Florida. Between 1528 and 1539, Spanish explorers arrived to the area in search of mineral springs, otherwise known as the Fountain of Youth. In 1539, the Espiritu Santo Springs were founded. These springs are believed to have natural healing powers and attract tourists to the area from all over the world. In the 18th century, ships would find refuge in Safety Harbor from pirates. They called Safety Harbor a safe harbor, hence the name. In 1823, Odette Philippi was the first non-native resident to settle into the area. He played a major role in the Florida citrus industry by introducing grapefruit. His plantation is now known as Philippi Park. In 1917, Safety Harbor was officially incorporated as a city in Pinellas County, Florida. Today, Safety Harbor is 4.9 square miles. As of 2016, the population was 17,606. This equates to a population density of 3,446 people per square mile. Safety Harbor residents reside in single-family style homes, townhomes, and mobile homes. There is one low-income housing community named U Park V. These schools in Safety Harbor are abundant. They consist of Safety Harbor Elementary, Lila Davis Elementary, Safety Harbor Middle School, Espiritu Santo Catholic School, North Bay Christian Academy, and preschools such as Alpha and Omega Learning Center, the Rainbow Garden Preschool, and Little People's Learning Center. Safety Harbor has a community center, a museum and cultural center, and also the Rigsby Recreation Center. The city of Safety Harbor is lacking in the low housing income category. The percentage of unemployed residents in Safety Harbor is 3.9%. Residents living below poverty level is 9.3%. The percentage of residents with a high school diploma is 94.3%, and 39.8% are college graduates. Based on an analysis of this information, there does not seem to be a population issue in Safety Harbor, as the majority of residents are all employed and living above poverty level. As for health concerns, tobacco use, cardiovascular disease, and diabetes are concerns. Safety Safety Harbor, Florida has one inpatient hospital, which is Meese Countryside Hospital. There are several walk-in clinics such as Baycare Urgent Care and AFC Urgent Care and PulMed PA. The skilled nursing facility in Safety Harbor is Consulate Healthcare of Safety Harbor. Assisted living facilities consist of Safety Harbor Senior Living, ALF Philippi Ridge, Magnolia House, Evergreen Manor Retirement, Teresa Home, Paradise Adult Living Services. All of these facilities vary in cost depending on insurance and availability of rooms. Some elderly and disabled services in Pinellas County are Gulf Coast Community Care, Neighborly Care Network, and Pinellas Opportunity Council and Shore Service. Some other community health resources in Pinellas County are Pinellas County Health Program and A Woman's Place Medical Clinic. The City of Safety Harbor alone is lacking in community health resources and hospitals, as there is only one hospital. In reference to Healthy People 2020, 3 community health objectives that would be beneficial to the City of Safety Harbor are heart disease and stroke, tobacco use, and access to healthcare services. Safety Harbor is working towards a healthier America by promoting the use of walking trails and recreational activities. Tobacco use is very prevalent, as residents were seen smoking upon the windshield survey. And as previously mentioned, there is only one inpatient hospital in the City of Safety Harbor, so access to healthcare services could be improved. The overall environment of Safety Harbor is very clean, quiet, and quaint. The abundance of public parks were noted to be well maintained. Little to no trash and debris were noted alongside roadways. Safety Harbor has their own fire department, which responds to the needs of residents in the community. One major concern is the roadway McMullen Booth. McMullen Booth Road is a high traffic area with frequent speeding, and there is also a bike lane on that road, which could be dangerous to oncoming cyclists. The government structure of Safety Harbor consists of a mayor, vice mayor, and 3 commissioners. City council meetings are held on the 3rd Friday of every month for residents to attend and address their concerns with city officials. There is a moderate amount of residents that attend these meetings. One issue noted in the budget in 2016 was in the Streets and Stormwater Division. 155 orders were placed, and out of those 155 orders, 122 were completed due to budgeting, with an expenditure of 3.82% in 2016. Parks and Recreation had an expenditure of 11.9% in 2016 and was able to offer 946 recreational programs to its residents. The number one community need of Safety Harbor would be more access to healthcare services. Safety Harbor has one inpatient hospital and 3 urgent care clinics within its city limits. This lack of healthcare facilities could result in residents not seeking medical care when needed. The second need would be in relation to heart disease and stroke. There were 3,266 deaths recorded in 2016 in Pinellas County, Florida. The third need would be smoking cessation. Upon the windshield survey, it was noted that there were residents smoking alongside roadways. In 2016, there were 663 deaths in Pinellas County in relation to lung disease. The fourth need would be a law enforcement agency specific to Safety Harbor. Currently, Safety Harbor uses Pinellas County Sheriffs and Clearwater PD to patrol their roadways. If they had their own law enforcement agency, this may help out in our next need, which is number 5, speed control. There are high traffic areas in Safety Harbor, and there have been numerous speed control attempts such as flat top speed humps, radar speed monitoring, and raised crosswalks. In 2016, in Pinellas County, there were 19,096 vehicular crashes noted. The sixth need would be more low-income housing. Safety Harbor has one low-income housing complex. Florida alone has 2,167 total, that one only being in Safety Harbor.